Hi, I'm Justin Riley, and today on Wisconsin Doctors, we're going to be finding out about the different types of therapies that are available here at the Fort Healthcare Therapy and Sports Center right in Fort Atkinson. Topics will include physical therapy, occupational therapy, sports medicine, and athletic training. My guests will include Julia Nepple, who is the Director of Sports Medicine here at Fort Healthcare, Alyssa Villarreal, occupational therapist, Kyle Newcomb, physical therapist, and Brian Meitner, the athletic trainer. It's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. We're on location at the Fort Healthcare Therapy and Sports Center here in Fort Atkinson, and we're going to be talking a lot about physical therapy today, and I'm joined now by the Sports Medicine Coordinator, Julia Nepple. Welcome.
Good morning and welcome to the Fort Therapy and Sports Center.
Yeah, thanks for hosting us here. So talk to us a little bit about what types of therapy you offer here at Fort Healthcare.
We offer a variety of therapy at Fort Healthcare. We have 60 providers at 4 different locations.
Oh wow, okay.
To offer the people of Jefferson County and beyond a lot of different services. This includes physical therapy, occupational therapy, athletic training, speech therapy, and massage therapy.
Lots of different therapies, and a lot of people when they think therapy, they think the physical aspect, but speech therapy is a big portion of that.
We do have all different types of therapy here.
Absolutely. And what sets Fort Healthcare apart from other therapy centers in Wisconsin?
Well, we're close to home. We have lots of specialty clinics or providers within our clinic that we provide services for pediatrics. We provide services for aquatics, dry needling, concussion care, lymphedema treatment, all different types of treatment, including pediatric bowel and bladder, adult men and women's health types of activities, as well as work-related injuries, as well as all different types of things.
Okay, very cool, very cool. And you have a sort of a team approach to therapy here. Can you talk to us a little bit about that?
We do have a team approach. We have an integrated approach where our providers work very close contact with our physicians.
Yeah.
We have actual direct contact with our orthopedic surgeons, our urologists, our women's health providers, our OBGYNs, as well as our work-related physicians as well. And so we have weekly communication with them that allows us to have a real integrated treatment plan, as well as us working together as a therapy group. We have OTs and PTs and ATs working together to help provide the best care that we can for our patients.
So you're having conversations with the orthopedic surgeons here on a regular basis?
On a regular basis.
To provide the best level of care for patients. That's
to really
awesome.
integrate that treatment process. Not just the exercise part, not just the medicine, really getting it all together.
And I think that's important to note that it really is an integrated process. It's not compartmentalized at all.
No, that we all work together as a big team.
That's awesome. So we talked a little bit before the show about direct access to physical therapy. What does that mean, direct access?
Direct access is currently in the state of Wisconsin, physical therapists have the opportunity to see patients directly. They don't have to have a physician referral.
Okay.
Historically, people come to physical therapy or occupational therapy or speech or whatever with a direct referral from a primary care or a specialty care provider.
Sure.
And then they send the referral over and they come and see us. Fort Healthcare has just started a direct access, so patients can call for physical therapy type services and come right in to see us. The hard part about this, unfortunately, is there's not insurance coverage for everyone on that scenario yet. So it's really dependent, so I really encourage patients to check with their insurance to make sure it's something that they provide.
Yeah, always check with your insurance first. Really quickly, before we go here, you mentioned a technique called dry needling. I'm not familiar with that. Can you talk to us a little bit about what that is?
The dry needling is a process that puts needles basically into a person's skin to help deactivate their muscles. And Kyle Newcomb is one of our guys that will be working on that with you in a bit.
Oh, that's very cool. So we have that to look forward to. Well, excellent, excellent. Well, Julia Nepple, you are the Sports Medicine Coordinator here at Fort Healthcare. Thank you so much for the info today.
Thank you.
We're on location here at Fort Healthcare, the Therapy and Sports Center, part of Fort Healthcare right here in Fort Atkinson. And there's more Wisconsin Doctors coming up right after this. Stick around. And welcome back to Wisconsin Doctors. We're on location at the Fort Healthcare Therapy and Sports Center right here in Fort Atkinson. And we've been talking a little bit about physical therapy and rehabilitation. And a big part of rehabilitation is occupational therapy. And here to talk more about that is Alyssa Villarreal, occupational therapist here at Fort Healthcare. Welcome to the program.
Thank you.
Good to have you with us. Good to be here. So we're going to talk about occupational therapy as it applies to the upper extremities. What kind of upper extremity injuries do you see most often in therapy?
So in this setting, we're actually capable of seeing anything from the fingertip all the way up to the shoulder.
Oh, wow.
Most commonly, though, we see injuries that are a result of overuse or even abuse. So something like a tennis elbow or maybe a medial epicondylitis or a golfer's elbow is the common term.
Sure.
And then a rotator cuff tendonitis, even sometimes a wrist tendonitis as well. But we also can see conditions that are a result of chronic or traumatic onset, so something that would require surgery like a rotator cuff repair, a distal bicep repair, a labral repair, or even ligament reconstruction like with Tommy John surgery.
Yeah, now Tommy John surgery, we talked a little bit about this before we started here today. You mentioned that as one of the things you see in therapy. Talk to us a little bit about what Tommy John surgery is and how do you treat it in therapy?
Yeah, so Tommy John's is actually a surgery that's named after the first person to ever have the surgery done. So Tommy John's was a very successful Major League Baseball pitcher and had torn his ulnar collateral ligament, which sounds like a very fancy word, but it's a ligament that's responsible for stabilizing the elbow. So when a baseball player goes to throw, their arm kind of comes out like this, and the ligament is specifically responsible for stabilizing in that setting. And so a lot of baseball players will have this injury where they actually tear that ligament and they require surgery as a result. So in therapy, we'll work with those patients either before or after, or sometimes both, to try to reduce the inflammation as a result of that injury or restore their range of motion. And then most importantly, we try to recover the stability of that elbow through strengthening. And then sometimes, especially if it is a result of a sport like baseball, then we'll want to do some analysis of the mechanics of the sport to make sure that they don't risk re-injuring the muscle or re-injuring that ligament.
Absolutely. And I'm just curious, do you do a lot of work with folks before surgery? I mean, is the goal to try to do as much therapy with them so that maybe they don't even need surgery?
Yeah, we definitely do try to reduce having to need surgery if possible. And what we know from research is that people who go into surgery with reduced inflammation, with more motion, and with better strength come out of surgery a lot better in the long run.
So even though they may definitely need surgery, it's good to have therapy beforehand, too.
Absolutely.
So that's great. I hear a lot of people mention the rotator cuff. You know, I've had this issue with my rotator cuff. First of all, what is the rotator cuff?
Yeah, the rotator cuff.
You got a demonstration.
I do have a demonstration.
All right.
So it's a group of 4 muscles that actually surround the shoulder blade. So if this
Okay.
is the shoulder blade, you have one muscle that's in the front, one that's in the top, and then 2 that are actually on the back side. And those muscles originate on the shoulder blade, but they actually attach to the humeral head or the arm bone, the top of it, up here. And so they each have an action that they do on their own in relation to moving the shoulder and moving the arm. However, they all together combine to stabilize the actual humeral head while the arm is doing something. For example, if you reach up into the top of a cupboard, you want that the ball and socket joint of the shoulder to stay in place so that it's not dislocating as you were to do a task. So the rotator cuff is the common stabilizing.
So the rotator cuff is literally like a group of muscles then?
Exactly.
Okay, yeah. It's so interesting to me to find out how many muscles are just there basically for stabilization.
Yeah.
I mean, you know, it's not just for heavy lifting and things like that. It's really to keep our balance, to kind of keep the bones in place.
Exactly. It's extremely important.
Yeah. So how would I know if the pain that I was having was actually related to my rotator cuff? If I have shoulder pain, does that automatically mean that I've got an issue with my rotator cuff?
Not necessarily. It kind of depends on where the location of pain is. So rotator cuff pain is one of the more tricky pains to diagnose because it can be in the front of the shoulder, the side of the shoulder, even in the back of the shoulder. A lot of times people actually come in saying that they're having pain lower in the arm, but that pain is actually a rotator cuff referred pain. So we look at location, but we also look at what people are saying for their symptoms. So some people will be telling me they have a hard time when they're going to brush their hair or when they want to tuck in their shirt. Or an athlete might tell me that after pitching, 70 throws that their arm just feels very tired or heavy, and that's kind of a common symptom for rotator cuff related pain.
Sure. So if you're feeling that kind of pain, obviously check with your doctor first, and it might be something that to look into further then.
Exactly.
Yep. Alyssa Villarreal, occupational therapist here at Fort Healthcare. Thank you so much for joining us.
Thank you.
And don't you go away. There is more Wisconsin Doctors coming up right here at Fort Healthcare right after this. Stick around. And welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Therapy and Sports Center right in Fort Atkinson. And we've been talking a lot about physical therapy, occupational therapy, and rehabilitation. And now we're going to talk with our resident physical therapist, Kyle Newcomb. Welcome to the program.
Thank you for having me.
Yeah, you bet. Thanks for hosting us here. So, Julia, when she was here earlier in the show, mentioned a little bit about dry needling, and she said that you were going to talk to us a little bit about dry needling. So I'm excited to hear, what is dry needling?
So dry needling is a physical therapy intervention that we use by inserting a needle into a trigger point. So a trigger point is a hyper-irritable tissue within the muscle that kind of creates a taut band within the muscle. And by sticking the needle into the trigger point, you create a twitch, and that twitch will then release that taut band of tissue.
Oh, interesting. Now, I'm not knowing a whole lot about this. This sounds a little bit like acupuncture. Is this acupuncture, or is it similar?
No, and that's probably the most common question that we get. The similarity begins and ends with the tool that we use. We both use the needle. However, our training is much different. So an acupuncturist is going to be trained through a traditional Chinese medicine, where dry needling is firmly rooted in Western medicine.
Sure.
So the variances will be in the way that we assess the tissue, the way that we evaluate the person, the movement dysfunction, and then how we apply the needling is a little bit different, as well as the overall intended goal is different than that of acupuncture. I would say the most common analogy I use is soccer and football are played on the same field, but I think no one would question that they're two different sports.
Right.
So I would say the field and the needle being the commonality, but
Yeah.
beyond that, they're much different.
Yeah, very, very different. So how exactly does it work then? You said you insert this needle and then it somehow releases tension.
Yeah, our goal is to create a local twitch response within that. So we palpate and try to find the most irritable spot of the trigger point. And then we're going to insert the needle into that tissue. And then once that is inserted, we create a twitch. And that twitch will create a cascade of chemical events within the muscle tissue. And those chemical events will lead to decreased irritability of that tissue. And then it's also been visible on MRI and on real-time ultrasound after the treatment's done. You can see the changes of that banding actually releasing the muscle tissue. So there's actually some pretty good science out there. It's already kind of shown the effects, as well as those chemical changes have improved via muscle biopsy, pre-needling and post-needling.
That's fascinating. And what has been patients' responses to it while it's happening? Does it hurt? Is it uncomfortable at all?
Everyone's a little bit different. So with any treatment, people respond differently. The more relaxed someone is during the treatment, the better it goes generally.
Sure.
And some people just aren't cut for it, and that's fine. Most of the people do really well. A lot of people have hesitation going into it. And then once they get into it, they say my palpation is actually a lot worse than the needle itself. So
Wow, that's so fascinating. So, what does a person need to be diagnosed with to benefit from dry needling?
So the beauty of it is really any muscle can be needled. So any muscular pain or any joint pain that might have some irritability of the surrounding tissues will likely benefit from the needling. So it's a really powerful tool that can be used for pretty much any musculoskeletal condition. Some more common ones I see, pretty much any back or neck pain, headaches, hip pain, sciatica, plantar fasciitis, Achilles tendonitis. Basically the list goes on and on. It's as basically as that patient can be appropriate for that treatment, or are they going to be better off with just more of a traditional therapy?
That's fascinating. And is this something, to your knowledge, is this something that insurance companies typically cover?
So at Fort Healthcare, there is not a specific treatment or billing code that is out for dry needling as of yet. So at Fort Healthcare, what we do is we don't charge for the needling itself. When it comes down to in our treatment session, the needling lasts usually around 5 minutes, give or take a minute or two. So at that point, what we do is we just don't bill for that period of time, but then the whole totality of therapy, we have manual therapy, exercises, postural correction, body mechanics, and that's what's really going to lead to the ultimate changes and the long-term gains for our patients. The needling is a very powerful tool to help them get on the right track, but then ultimately it's what we do to help address the dysfunction, whether it's a weakness, a tightness, through the manual therapy and the exercise that really, and then we'll bill for that, which is certainly covered by insurance.
So it's kind of part of the bigger package, basically.
Yeah, it's just one tool, and it's a very powerful tool, but it really helps kind of speed the process along with physical therapy.
Yeah.
And then we also have at Ford Healthcare a direct self-pay. If you just want to come in for needling and did not want the totality of the PT experience, which I would still recommend.
Sure.
But the dry needling option is offered as a self-pay option here as well.
Good to know. Kyle Newcomb, physical therapist here at Ford Healthcare. Thank you so much for joining us.
Thank you.
Don't go away. There's more Wisconsin Doctors coming up right here at Fort Healthcare. Stick around. Hey folks, welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Therapy and Sports Center right here in Fort Atkinson. And next I'll be talking with Brian Meitner, who is the athletic trainer here. Welcome.
Thank you.
Good to have you with us. Thanks for having us here. So let's talk a little bit about what is an athletic trainer. What do athletic trainers do?
An athletic trainer is an allied health professional with at least a bachelor's degree in a related science field. And has passed a rigorous national certification exam. Our responsibilities include being in charge of on-field management of injuries, making decisions regarding return to play after an injury, rehabilitation of injuries, including strength and flexibility programs, and proper management and equipment usage and fitting, including not only football helmets and shoulder pads, but ankle braces and knee braces and whatever kind of braces an athlete might need.
And you mentioned on-field management of injuries, is that correct?
That's right.
Are you on-field a lot of the time, or are you mainly based here?
No, I'm based here for part of the day.
Okay.
And then I go out to a school that I'm contracted with, which happens to be Cambridge High School.
Okay.
And I cover sporting events, the high-risk kind of sports.
Sure.
Football, soccer,
Right.
boys and girls basketball, wrestling. And I'm on the sidelines for if an athlete happens to get injured.
Yeah. So what brought you to the field of athletic training?
Well, growing up, I was always a real active person, always kind of a so-called gym rat, and I wanted to carry that on into college. Initially, I wanted to be a Phi Ed teacher and coach, but I found out in my junior year that there weren't a lot of job opportunities in that field at the time. So a friend of mine talked me into coming and being a student trainer for the football team at UW Whitewater. And I like the activity, I like the science of athletic training, and I've been in it ever since.
Excellent. Now, I want to make sure that viewers know that you are able to help folks who are not necessarily playing some of those high-risk sports and are obviously not professional athletes. What can you do? What can you offer to folks who are just average folks who just have average jobs and aren't playing sports on a regular basis?
Right. Athletic trainers work in a lot of different settings. Like you mentioned, I work here in the clinic for part of the day, and then I go to the high school. Athletic trainers also work in a variety of other fields, including industrial and commercial settings. Some athletic trainers kind of branch out into their own kind of specializations, and that's one of my things that I do. In addition to my other athletic training duties, my interest is in video analysis and biomechanical analysis of sports, specifically overhand throwing, golf, and running. And we have some programs here that we see athletes or non-athletes called the EDGE program and Get and Fit program. And one is just simply getting a person into a fitness program because they don't know how to start or where to go.
Right,
and
yeah.
we follow them through and track their progress and give them ideas on how to do things.
And I'd imagine that part of that is giving them ideas on how to do things and preventing injury. So if they've never been in a sort of fitness program before, you can kind of give them ideas on how they can do it safely too.
Exactly. One of the biggest mainstays of athletic training in general is overall prevention of injuries. Right. We want to prevent injuries well before they become a problem.
And speaking of prevention, concussions are a hot topic right now, especially when it pertains to high school sports. How has the treatment of concussions changed over the years?
Concussion treatment has changed dramatically with the impact with what's referred to as the IMPACT program or neurocognitive testing. IMPACT is just one brand of neurocognitive testing. And we've included that at the high school level with all of the high schools that we contract with. What we do is we provide a baseline test prior to the season to find out where an athlete is under normal circumstances, how their brain functions under normal circumstances. And then if they happen to suffer a concussion at some point, then we bring them back in and retest them and make sure that they're back to so-called baseline so that they don't return to their sports while they're still symptomatic,
Right.
which can lead to very long-term and dangerous consequences.
Yeah, they got to make sure that they recover from that for sure. Other major changes in sports that you've dealt with as an athletic trainer over the years?
Probably the two most major ones is in 1991, the WIAA instituted the Wisconsin Wrestling Management Weight Project, which utilizes body fat measurements
Sure,
and hydration measurements to make
Right.
sure that wrestlers aren't losing weight improperly
Right.
and are being properly getting the proper nutrition.
Yeah.
Probably the other one has been the over-specialization of sports at the youth and high school level. This leads to chronic injuries at major joints, and we're seeing a lot more younger and younger athletes getting injuries that typically happen to older and older athletes,
Sure.
kind of like the one that Alyssa mentioned earlier with the Tommy John surgery.
Right.
There's a lot more high school age and even younger athletes suffering from Tommy John injuries because they specialize at throwing and baseball at a younger and younger age, and they do it year round, and they overuse the ligament at the elbow, and they end up suffering what can turn into a lifelong kind of problem.
Yeah, and really quick before we go, I'm going to let you kind of wrap this whole thing together in a nice little package. Why should folks come here to Fort Atkinson for physical therapy and athletic training?
Well, we've had sports medicine here at Fort Therapy and Sports Center, Fort Atkinson, for 25 plus years.
Yeah.
We provide the same service that any big town or professional team
Sure.
would provide as far as orthopedic surgery, the physical therapy, the athletic training. You don't need to go to a big town to get the same kind of big town service.
Absolutely.
We provide all that right here in Fort
Yeah,
Atkinson.
a lot of experience here. Brian Meitner, athletic trainer here at Fort Healthcare. Thank you so much for joining us. And thank you for joining us. That's all the time we have for Wisconsin Doctors from all of us here at CW57. We're inviting you to live longer, live better. We'll see you next time.